My name is Manny Felix. I'm the Senior Manager for Medicaid Sales for Blue Cross Blue Shield Health Choice Pathway. A lot of agents are familiar with Blue Cross, Medicare Advantage, Medicare Supplement, but a lot of agents are not aware that we also have a dual special needs plan for folks that are enrolled in both in Medicaid as well as in Medicare. So today I'll be talking about D-SNP, dual special needs. If you ever sell our plan and you have a scope of appointment, the scope of appointment needs to contain the beneficiary's name, address, and phone number. And if the scope of appointment was not completed within 48 hours, just write what the reason was. If they walked into an appointment, if they walked in, if you're at a table and tabling event, someone comes in and says, "Hey, I want to enroll in this plan," just write what it was. There's circumstances that you are able to enroll someone within less than 48 hours prior to the appointment. And you can note that on that form itself. Now, if your application is selected as part of an audit, whether it be internal or regulatory, like from CMS, it's mandatory to comply and respond and provide the required information as soon as possible. Failure to do so will impact your ready to sell status as well as your ability to receive future commissions. And we're always really flexible when it comes to that. We had someone last year that stated that they were out of town. So, they were able to respond, and we were able to note on those particular applications that they would be pending once the agent returned from their trip. I want to mention the Medicare General Enrollment period, because in Arizona is considered a buy-in state. Okay, Arizona is considered a group payer state, not a buy-in state, and so a lot of agents sometimes they feel that if someone's enrolled in Medicaid, they can enroll in Medicare Part A or Part B at any given time. And that's not the case, because Arizona is a group payer state. We have to follow the Medicare General Enrollment period, which falls between January 1st to March 31st of every calendar year. Now, other states that are considered a buy-in state, the beneficiary is able to enroll in Medicare Part A or Medicare Part B at any given time during the year, as long as they submit a conditional Part A or Part B application. The difference, if someone is not eligible for Medicare Part A and there are 30 quarters or more under for Social Security, or they have more than 30 quarters or more under Social Security, then their monthly premium for Part A will be $285. If they're less than 30 quarters or more, then their monthly premium will be $518, and then the Medicare Part B premium for 2025 is $185. So I would like to share this piece of information, because a lot of times, like I said, agents tend to think that if someone's enrolled in Medicaid, they can enroll in Medicare Part A or Part B at any time during the year, and that's not the case. Now, default enrollment, I like to mention this because a lot of agents tend to think that if someone's enrolled in Medicaid and they become eligible for Medicare, then the agent can't do anything about it. So that is known as default enrollment. So default enrollment is when someone is aging into Medicare and they're enrolled in a Medicaid plan. In Arizona, Medicaid is known as Access. That particular individual will be automatically, or what we call default enrolled in that plan's D-SNP 3 months prior to their Medicare effective date. That is known as default enrollment. Now, the criteria needs that the D-SNP plan needs to have a star rating of 3 stars or more to participate in default enrollment, and the beneficiaries need to be notified of their enrollment 60 days prior to their effective date. So if you have someone that is turning 65, let's say in September, then that person will more than likely be default enrolled into that Medicaid plan's D-SNP, probably in the first or second week of June, because that's 3 months prior to their effective date. Now, beneficiaries can opt out of default enrollment by contacting their plan directly. So if someone says, "Hey, you know what? I want to choose the plan that I want to enroll in," they're able to opt out of that enrollment. But for the most part, here in Arizona, all of the D-SNP carriers, they participate in default enrollment except for one, and that's Mercy Care. And the reason for that is because they have a 2.5 star rating. Now, if the Medicare beneficiary is not default enrolled in that plan's D-SNP, they will be automatic or default enrolled into a prescription drug plan. I just want to say this because if you're talking to someone, let's say you're talking to someone that's turning 65 and they're enrolled in Medicaid, you want to schedule an appointment the first day 3 months prior to their effective date. So for example, let's say someone is turning 65 in September. You want to do is you want to schedule an appointment on June 1st or June 2nd. So that way you can become the agent of record. Wait till let's say the middle of June or the last week of June and they turn 65 in September, more than likely they're going to be automatically enrolled into that Medicaid's plan's D-SNP.